Hi everyone. I'm going to take this time to go over the chapters 1 and 2 outline that I had posted earlier for you. This is from actually to cover our first missed snow day this past week on Monday. And so I'm just going to take a little bit of time to go through these 9 discussion points. For this course, a lot of our units will be using this type of outline as our kind of way, as a kind of a discussion point to go through the material in this course. So it runs a little bit differently than the previous course I taught. But I kind of want this course to be a little bit more discussion based. And you can use this outline then as a way to guide your notes, as a way to take notes, those types of things. But also, when we do these units this way, your outlines will also be your study guide then for the exam. So you'll use these questions then from each chapter or each chapters as outlines to actually use those to, there won't be a separate study guide. You will use these as your study guide. They'll help guide you to study for the exam. So we're going to start with chapters 1 and 2. And the first discussion there, and it's hard to really discuss over a recording, but it talks about differentiating between social aging and biological aging. And so when we talk about social aging, it's really often looked at, and hopefully you read in your book, by the way people, I always think about the way people live or the way people socialize. The book talks a little bit about determined by the way they change in their roles. So a lot of times we think of social aging, we might think of maybe as somebody ages, they'll do things like retire. When they hit a certain age, they'll retire from their normal or their usual lifelong occupation. At that point in time, they might be looked at as an elder or some type of person in their community or in their church that people have respect towards. Sometimes in social aging, we might look as a monumental mark of a birth of a grandchild or kids getting married. So we hit these different points as we age. So they're usually those transitions in regards to our social aging are really marked by special things that occur in our life, maybe such as birthdays, like they consider when they hit 65, when they start going to retirement parties. Maybe they have invitations to join certain groups, like you hear of the AARP commercials on TV. Maybe when they go out to the restaurants, they get the senior citizens discount. So that's kind of where we think of social aging in regards to those kind of norms in society where they hit those monumental marks. That differs then from biological aging. In biological aging, when we think of biological, we think more of our age or chronological process. So biological aging, we think of our body changing. It's a continuous and complex process. As we get older, our cells in our body change. Our physical traits, which we might identify by, will also change. So maybe my whole life I've had brown hair. As I age, it turns to some gray and then eventually then to all gray. I might have, go from very nice smooth skin to wrinkled skin. So they're kind of more of those outward traits, genetic makeup things that we think about when we think about biological aging versus social aging. Number 2, it says, what are the limitations of using life expectancy, morbidity, and death tables to measure a population's health? Well, first of all, when you look at the words life expectancy, morbidity, and death tables, all of those really kind of focus on the actual illness or dying or death. And so when you think about measuring a population's health, we're really looking more at the morbid and the death types of things. So if you want to think about like the illnesses and those types of things. So it really doesn't look at as much, if we think about a population's health, If we're just solely looking at the illness, it doesn't really, or the death part of it, it doesn't really take a very good extent look at how many of the people are still living that are also still suffering from these issues if we're only looking more at the death part of it versus actual patient's health. So these tables really they don't really indicate the health status of an environment, really just reflect on the illness and a lot of times the death of the person as a result of the illness. So they don't really they give us a very narrow indicator of what we're really looking at. In number 3, it talks about what are the proposed goals for Healthy People 2020. And in Intro to Concepts, we talked a little bit about Healthy People. I introduced that website to you. And in that question there, it has the website, www.healthypeople.gov. And you can look there. They change them they add to them, they take away different things like that, especially every 10 years they cycle through those. So now we're on the 2020, and you can go to those websites to really look at that current information. When you go to that website, then you can actually look specifically for objectives for older adults. And when we really look at that aging population, some of the goals that Healthy People 2020 are really looking at in the elderly population specifically are trying to eliminate those preventable diseases. So how can we eliminate things like diabetes? For instance, they're looking at ways to alter their diet, exercise, those types of things, and how can we reduce that number? They might look at how to eliminate or decrease disability among the elderly people. So in regards to hopefully keeping them out of the wheelchair longer, or, what are issues that we can do to prevent things like that. They're also looking at injury, premature death, and so those are things that we'll talk about actually throughout this semester. They're also, a second one they're talking about under their goals of Healthy People 2020 is achieve health equity, eliminate disparities, and improve the health of all groups. And so we look at that continually through nursing. There are certain areas in which people have very good health because they probably have the access to different resources, different things that they need to have that health. If you don't have access to those things, like medical care, dental care, different things like that, how does that affect your ability to care for yourself and to eliminate some of those issues and to have better health among all groups of people? The third one we really look at, it says create social and physical environments that promote good health for all. So when we think of social and physical environments, we can think of a lot of different things. You can think of things like smoking, environmental wise. You can think of physical environments when we think of safety issues we've talked a lot about in 201 that are good for all people. And then the last one that they mention on that website, especially specifically looking at the older adults, is to promote healthy development and healthy behaviors. And that really goes across every stage of life. We hit on that a little bit last semester, but really looking at how we can develop into, things like nutrition, not smoking, moderate to low amount of drinking, different things like that, how that can affect then as on our life through every stage of life. We're going to next look at question number 4. It's actually on a different one. I think I introduced them last semester too. WHO, or the World Health Organization. And they have also an area on the web regarding aging. And they talk about who is, remember, the world health. So they're looking globally, not just in the United States. But really, when we look at that, how do they really relate to the United States, and how do they relate to Healthy People 2020? Well, if we look at the World Health, if you go to that website, the World Health Organization really ensures that older populations They want to have financial security, which you could kind of interplay with what we've talked about in Healthy People 2020. The second one is develop age-friendly environments. And we talked about that in the third one of Healthy People 2020, the creating social and physical environments that promote good health for all. The third one for the WHO is have access to effective health care. And that one we've talked about in Healthy People 2020. And the last one is maintain social patterns that influence the well-being of older adults. So a lot of those, actually, all of them really interrelate with what we're doing with Healthy People 2020 in the United States. And one of the things that I really want you to kind of take from that is the world is rapidly aging. So whether we're thinking of the United States or whether we're thinking of the world, it's an important challenge for us. WHO actually states that 70% of all older people now living whether the United States or the world, and this is really talking the world to be more specific, 70% of all older people are now living in low to middle income countries. And so population, even in the United States, is occurring a lot faster. And when we think about some of this stuff, we have to change the way we think on some of these things. So the faster that we have these aging populations presents a lot of problems for us. If you think about the United States alone, right now we have the baby boomers that are moving into that elderly or that aging older phase of their life. And so when we think about that, we think about them all retiring from their jobs. So right now we're having, if you even look at specifically, for instance, at nursing alone, there's huge openings in nursing because we have this huge population of baby boomers that are now starting to retire, and we don't have the ability to push out enough nursing students to take their place. And so there are a lot of openings. It's a good time to be in nursing because there's a lot of job openings, a lot of availabilities because we see this mass amount of baby boomers retire. Some of the trouble, though, that also causes is you hear about this if you watch TV or with the government stuff. Some of the big issues right now then are things like the Social Security system, the pension systems, healthcare, Medicare. All of those systems are majorly being taxed because our younger generations that feed into paying for those systems, we're a smaller amount of people. We aren't as large in an age group statistically as the baby boomers were. And so things like Social Security, we're paying in, and we don't pay in enough in order to keep up with the magnitude of how many people need that income. And so these are things that are happening all around the world. We're seeing an increased demand also for long term. And I think that's why in the curriculum a few years ago, Morningside started this course because we felt it was very important as these baby boomers are aging. Geriatrics is going to be one of the premier demands in nursing. And that won't necessarily be long-term care, but all of these things, we need to take on that large mass of these baby boomers that are retiring. So when we think of dealing with dementia, all these aged, as people age, the demands of care that will be needed in the acute settings, the home settings, those types of things are all increasing. So that will be kind of a big theme that we'll talk about a lot in this course and something that you'll really want to make sure that you're honing in on. Number 5 says, what components of the wellness model are applicable to aging? And so the wellness model, again, making sure that you're reading through your chapters. These chapters are very short in essence. They're usually only like 10 to 12 pages on average length. So make sure that you're reading these chapters as you go through. It's also a good idea to make sure that you are reading through those, making sure you're looking at the different boxes and those types of things when you're studying and doing these outlines. But the wellness model we talked about before, really looking at how do we grade wellness. And so we really want to think of if we can promote healthy aging among people and really looking at how individuals are likely to change over time and as they age. And so some of the things that we really want to work on or that we're trying to work on with healthy aging are things like functional independence. They can take care of themselves. They can manage themselves. They can manage their illness. So are they doing that in a positive manner? They have personal growth, social contribution. They have activities that promote one's health. So what kind of different opportunities are available out there for patients to be a part of that? Number 6, it says, discuss an interprofessional approach consisting of nursing, medicine, social work, and other health-related professions, including pharmacy, physical therapy, occupational therapy, nutrition, and more. How may all of these improve the health of an older person? And so when we look at nursing as only one component in that big interprofessional system, we really want to think about what things can we do when we think about working with all of these other disciplines. And so we'll talk a lot about interprofessional approach, and we did that last semester too by talking about how can we collaborate with these different types of medical care, medical issues to help give our patient the best care possible. Well, some of the things when we also talk about taking care of the patient, not only physically, but if we think of their social in regards to maybe their money aspects of care. And so we can really look at working across disciplines for better communication and really thinking about where are we duplicating services, how do we decrease errors that might be out there. You can just take like medical errors, or even we'll talk about medication errors. How do we decrease costs? And I'll give some examples as we go along throughout this semester, and also even in the medication lab, we'll talk a little bit more about that. So when we can work with other groups of interprofessionals, we can really have a better influence on how we can make decisions at a local level that will help our patients and the people that we care for. But also when we work as nurses as a whole, when we go to maybe things like in your senior year, you'll go to Des Moines and do some legislative work with people, like with your government officials, those types of things, have an active role in how we can make a difference in what works best, how we're doing things to make that positive change. Number 7, it says, discuss ways in which nursing research studies have impacted the quality of life for older adults. So there's a lot of different research that's always going on, especially today, because of geriatric population is going to be and is starting to become this largest population demographic-wise group that we are taking care of. And so nursing research is really looking at the quality of life of the older people, and especially trying to gain that, increase that over each decade. How can we make them healthier and more independent? And some of the most important research that's going on right now, some of the biggest ones are things with dementia. Another big one is reducing falls. You see a lot of reducing falls in how can we do that, what are safe practices. We don't really try to use we limit the use of restraints anymore, but what are mechanisms or safety things that we can do to reduce falls? So last semester we talked a lot about bed alarms, we talked about one-to-one, we talked about distraction, different things like that. Another one, a big one right now, is pain management. We'll talk about pain more specifically in some other chapters, and you'll also be getting an experience at the pain clinic this semester as part of your clinical site. Delirium kind of goes with the dementia. Care transitions, how we transition from the hospital to at home, how that whole transition process goes. And then they're also doing a lot of looking at end-of-life care. How can that be strengthened? And how can we do that better? So those are some of the things that nursing research, especially in the gerontological, is really looking at right now. Number 8 talks about, it says, lists 5 areas identified to be in need for gerontological nursing research. There is a whole slew of them. I'm not going to go through all of them, but there's huge needs for gerontological nursing research. And actually, I'm going to just have you go to, on page 20 of your book, I believe, box 2-3 will list a bunch of different ones that you can look at there, and you'll see more than 5 areas identified there. So there's lots of different things that are big topics, and some of them we mentioned even in the last question. And then lastly, for this outline, number 9, it says, discuss the impact of hospital readmission on the older adult. What are some regulatory agencies doing to address this problem? And so some of the statistics there, it says 1 in 5 older patients, so when we think of that geriatric population, 1 in 5 are readmitted to the hospital within 30 days of leaving. And so Medicare, 90% of those readmissions are Medicare patients, are unplanned, and they actually result in more than $17 billion, that's billion with a B, paying for return trips that really shouldn't have needed to happen if the patient would have gotten the right care in the first place. So these are just things that we can improve on, and that would save, it's more than $17 billion that we're spending on these needless things that don't need to happen. Another statistic there in your book, it says additionally 1 in 4 Medicare, now remember Medicare is your over 65, 1 in 4 Medicare patients admitted to the skilled nursing facilities from hospitals were readmitted to the hospital within 30 days. So up to 2/3 of these were potentially unavoidable situations that also could have been stopped. So kind of scary statistically wise, but nurses have that first line impact into what we can do and be that change that needs to happen to reduce those. So Medicare and Medicaid services, remember the Center for they also are known as CMS. They've identified, and I think we may have briefly touched on this last semester, but they've identified these areas. And if I forgot to talk about this last semester, they have identified some of these areas as what they call unavoidable, or avoidable, I should say, avoidable readmissions. And so sometimes they'll say that they're never events. And so essentially what they're saying is that if hospitals do these certain things, if patients return after within those 30 days for this reason or that reason, and they're specifically stating those reasons, then CMS, or the Center for Medicare and Medicaid Services, will actually fine or penalize hospitals and healthcare systems who have a high rate of these. And some of those things are heart failure, heart attack, pneumonia, but there's several other things like that. And what they're trying to do is, hospitals obviously don't like their money not given to them for reimbursement. They need that reimbursement. And so what they're hoping is that hospitals and doctors will be and nurses will be a little bit more careful in deciding when and how, and doing their examinations as to when and how a patient should discharge, to make sure that they try to avoid some of these poor readmission rates, and try to look at how we can transition them in a better way so that we avoid also those readmission rates. So those are questions 1 through 9 for the chapters 1 and 2 outline. So hopefully, again, making sure that you read those chapters. They are a lot shorter compared to some of the other textbook chapters. And also, again, making sure that you listen closely when we're in class or whether you're on this outline, because these are your outlines then to help you study for these exams. I will follow up here and start recording chapters 3 and 4, but I hope you got everything you needed to know, and ask me if you have any questions after you listen to this VoiceCast podcast. Thanks.